Welcome back, everybody, to Health in the Hills, sponsored by the Pike County Health Department. I'm Jeff Vanderbeck, your host. Today, we're going to talk about some really important things. Everything we talk about with the health department is very important, but we have some special guests with us again. We always have Tammy Riley here because she's just everywhere. And today we have Paula Compton, and Paula's going to talk to us a little bit about the HANDS program. I don't know if you could see it, but this is what it's all about. We're going to talk about the HANDS program, what it is, how it's funded, why it's important to the community, and why the health department sponsors programs like this to keep people safe and keep people healthy. So, welcome, ladies, to the podcast. Tammy, welcome.
Thank you, Jeff.
Paula, welcome.
Thank
Paula,
you.
who are you? What do you do? And what do you do at the health department?
I'm a nurse and I work with the HANDS program as the program manager,
Okay.
and I've been with the health department about 22 years.
Huh. What's your nursing background?
Um, Home health, then health department,
You're a diabetes specialist for a
diabetes
while there.
Okay.
program, community health.
Nice.
I've been in different programs.
So tell me about the HANDS program. So HANDS stands for Health Access Nurturing Development Services. Tell me what the program's all about.
HANDS is a program that is a support system to a family that's getting ready to have a new baby or has a newborn. And we offer a curriculum that we teach that's called Growing Great Kids. And we visit families and give them educational information every time we see them.
So you actually go out and visit families?
Th-
Or
This
how
is
do
voluntary. It's a
vol-
voluntary home visit program.
Okay, how do I get if I'm having a baby, which would be a miracle because I can't have a baby, but if I'm having a baby and I want to get access to this program, what do I do?
Okay, you can call the health department and just say, I want to speak to someone in HANDS, and they will connect us. We'll take a referral, what is what we call the information, and then we schedule an appointment with them. We go and visit them and get them signed up. We tell them all about the program, usually on the phone.
Sure.
But if they want to come by and just ask for hands, then we can talk to them at the office and explain everything. Sometimes that's more of an introduction than having us just come
Sure.
out to visit.
Well, I think a home visit is important too because you see the environment
Mhm.
and all that stuff, and I think you can make some suggestions accordingly too. That's part of the program that I think you guys would do as well. Would that be a fair statement?
We teach like healthy home environment type of things,
Right.
but in the ultimately it's the family's decision,
Sure.
if they want to accept what we suggest.
Right. But you
And
can
another important aspect of visiting the family in the home is so that it makes them more comfortable to understand like they're going to have an assigned what we call ongoing home visitor.
right.
And that individual gets to know the family very intimately. But, we hope that they start early, like as soon as they find out they're expecting, and that they follow through with the program until the baby's 2 years old. But the point is, we try to connect the families with the best fit for the ongoing home visitor. And that individual becomes very close with the family. Many times the kids think that call them their aunt or second
Sure. Right.
baby or something along that. They usually have little pet nicknames for their ongoing home visitor, and the relationship gets quite close, actually.
Right.
Would you not agree, Paula?
Yeah.
So, Tammy, why is the HANDS program important to young families in Kentucky? What makes it so vitally important? And tell me a little bit about the success that you've had.
It's vitally important because what many people don't know is that by the age of 2, children develop about 80% of their brain development has occurred. By the age of 3, it's predicted to be around 90%. So a lot happens during those first 2 years. The prenatal side of it, before the baby is born, is also very important. Paula mentioned a curriculum. So they have a set curriculum that they follow from prenatal through that age 2 years. So they follow the curriculum, it's evidence based. They know what to be teaching at the particular stages. So from prenatal to ensure they're getting, all of the prenatal care, that they're ready for the baby to come. There's a lot of anxiety, would you not say, Paula? Whether it's your first baby or your third or fourth baby, there's anxiety around bringing a newborn home.
Sure.
And so the ongoing home visitor, as well as Paula, who's a nurse, and we also have a social worker on staff, that family has nearly 24/7 access to these high-level professionals to call, text, ask questions. They have a HIPAA-compliant communication
Sure.
mode that they
Right.
communicate with the families, but they can communicate with their families and ask those questions, get those questions answered, as well as follow this evidence-based curriculum. That is it's just really important. The earlier that we can connect with the families, the better, outcomes. What is that? Happy homes, happy families that we say
Sure.
in the HANDS program. It just makes for, healthier, happier moms and healthier, happier babies
And families altogether.
and families.
So
There's better outcomes
right, exactly.
in the HANDS
Because
program.
the more, the more people, particularly out in the outlying areas, the more people you have access to help you with this. So, when your baby's crying at 2 o'clock in the morning, you can't get them to quiet down. They know that this is normal. That's what babies do.
And how much does this program cost the families,
That's my
Paula?
next
Yeah, I
question.
knew
How
it.
much does it cost the family?
It's covered. Nobody ever has to pay to have hands. We can bill Medicaid, and we also have funding through the state that's called Tobacco Fund. If a family is like a private insurance, we use the tobacco fund to cover.
Or even uninsured.
Or uninsured, right?
Yes.
So it doesn't cost the family anything, and it gets. You mentioned a key buzzword to me was high level people that are going to be able to give you some advice on that.
Right.
So over the years, what have you found is the most important thing? I mean, you go into the homes and you deal with a lot of these people, I'm sure, correct?
Yes.
What have you found? What do you think is the most exciting or unique thing about the hands program and people don't know about it? Like when you go to a home to an expecting family and you go through all the information that the hands program offers, what are they most excited about, or what do you think is the most unique thing about it that they don't know about?
The brain development. We talk about brain development. We teach them brain builder activities and things that they can do with their baby to help them build more pathways in the baby's brain before they are 2 years of age, so they can get the most brain development while those windows of opportunity are open. So there's certain opportunities at certain ages. And if they don't know to do those activities with the baby during that time frame, then they won't build as many pathways in the brain.
Right, sure.
And I'm sure you have probably many examples of referrals that have occurred, like a family may not realize or recognize that a baby's not met a beach mark.
Sure.
A mother may be experiencing postpartum depression. So there's
Screenings.
screenings that are in place that we provide the family, again, at no cost to the family, and we can point that out and guide them, whether it's speech development or motor skill development or, like I said, postpartum depression.
Sure.
So there's screenings for all of that, right, Paula?
We're screening them every 2 months. And then if they need a referral to First Steps, they will get physical therapy, speech therapy through that program. But we have the ability to refer any of our babies to whatever service
Sure.
that they need.
Well, I wish you were around when my brain was developing because I could have used you because I'm clearly not developed.
Oh, it'd be scary.
Yeah,
That
I
would be
know. Can you
scary if
imagine
you
that?
think
So tell me, how does this? I mean, it sounds like you've got your family doctor, your family pediatrician, or whatever when they're that age, and you've got you guys. So how do you guys coordinate efforts together to make sure that the child and the family are getting the maximum information and ability out of either the family doctor or the health department's hands program?
Okay, we um, can refer them to all these resources.
And you can
I
use it at the
actually,
doctor's offices as well, right? And those
uh,
pediatricians
we promote our services
there.
to those physicians. So,
Sure.
and they know the local physicians know what we do, and they have our brochures. They recommend hands often, and we have all these resources. Every resource that we know of, we share it with our families in our community. So we try to, and we have the ability to correspond with the physicians if they're in the hands program and say we're there and there's a problem. We have um, the parents sign a release of information for us to correspond with the physician when they come on board,
Right.
so that if there's something they need and they want us to make a call for them, then we can, or help them get uh, the vaccine records to their physician, different things. We can help
Sure.
coordinate things with their WIC.
Right.
Um, and
WIC is the Women and for Children program. Right.
Yeah.
yeah,
Although this is not an income-based program,
Right.
so we have all socioeconomic status,
Sure.
participants represented from physicians, nurse practitioners,
Well, I don't
teachers.
care how smart you are. I don't care how rich you are, how poor you are, how dumb you are. Babies do not come with a handbook.
That's right. And
So
there's some anxiety around bringing a new baby home, again,
yes.
I
regardless
don't
of
care who you are. There's always a lot of tension. There's a lot of anxiety. You mentioned something, Tammy, about referrals. So let's say that I'm a grandfather, which I am, but that's a whole different story. And I see that my son or my daughter is going through some stuff, and they're just having a hard time. Can I just pick up the phone and say, "Hey, listen, my daughter just had a baby, 6 weeks ago. She has nobody out there. She needs help. I think she's got postpartum. She's getting some
Yeah.
depression. Can you help?" And would you be able to pick up the phone or at least make a visit?
We get a lot of referrals through grandparents. Now there is a stipulation, Polly, about like when the baby can enter the program. Because if
90.
they enter too late, there's just not enough time
Right.
for us to be able to provide enough resources to really have the full impact of
So
the
so
program.
so
So
me entering the program now probably wouldn't work.
we'd do the best that we could, Jeff.
Yeah, you
You
good
know?
luck. Well,
But there's
it'd take a lot of money.
is it 60 days, Paul?
90.
90.
90
Thank you. You
days.
always have to help me with
They
that.
have to get into the program before the baby is 90 days old.
90 days old, it says right in the brochure.
I know, I know.
So after they are 90 days old, they wouldn't get the full benefits of the program.
So as soon as you have conception, as soon as you have confirmation that you're pregnant,
You can
the
start.
best thing to do is pick up the phone, call 509-5500 and say, "Hey, I'm pregnant. I want to get into the hands program."
Has to speak to someone in hands. And there's a lot of perks and incentives that families receive.
Sure.
In addition to the services and the curriculum, there's a lot of fun perks.
Sure.
Like we have an owlet. I don't know if you know about owlet socks that help
Yes.
prevent sudden
Right.
unexplained infant death that are provided to families who need. There's car seats,
Mm.
incentive cards. So there's a lot of perks and families get together for a graduation. They have an annual Christmas party. So there's, wouldn't you say, a lot of perks
Yeah.
around supporting families and encouraging them
Sure.
through the participation of the program.
What's the time frame? So from conception or whatever
Mhm.
these people get pregnant, these women get pregnant. When a woman gets pregnant and they have their baby, how long does the hands program work with the baby? What age does it say, okay, we need to move on to different things? Is it 2? Is it 5?
To
Okay.
At age 2, they normally graduate off of the hands program. If there's something going on in the home, family has a lot of stress, a lot of challenges, and they need extra assistance, we can with really good documentation, we can keep them until they're 3.
Okay. So it's not like you're just, at 2 years old, they're abandoned. They could have up until 3. But when a child graduates, you've got all the records, you got all the documentation, you've got a game plan for the family.
That's
And
correct.
let me ask you this question, and you may not know this, but when babies graduate, do their parents just call and say, "Hey, listen, I just want to thank you. This is what happened with my child, and he or she is really getting to be a great person, and I can't tell you what the hands program has done for me."
Actually, they've been studying the hands outcomes, and we are evidence based of making an impact that children do better when they go to school after they've been through the hands program.
Sure.
And many families, I would say most families, once they've gone through the HANDS program, they want to continue, with the second child and
Sure.
subsequent children. uh, grandparents see like maybe one family member benefit from the hands program, and they tell their other children or family members about the hands program. One of my grandchildren went through the hands program, and that was before I was in public health, and I just thought it was the most fabulous program I'd ever seen. I
Yeah.
couldn't believe that they came out and provided the service at no direct charge to
Sure.
us.
The family. Sure.
So it's a fabulous program. It has a lot of benefits at no direct cost to the family. We do bill Medicaid if they have Medicaid. There's funding for private insurance and uninsured. But and we stick with the families. And again, like I said, there's usually a very close bond with the family home visitor and the family.
Sure.
They become quite close.
Well, that's good. Um, as the kids progress, there are other programs that are they could be beneficial through the health department, and that would
Yes.
be like the WIC
The WIC
program, that could be
program.
program, that could be any of the other like the
Right.
vaccination program,
Yeah.
all that other stuff.
Our school, well, we do a lot of school-based services, but in the clinic, we have WIC, we have school and sport physicals, the vaccination program. A lot of times we're working with families. Most children have their own pediatricians and
Sure,
they go there for their childhood vaccines, but we help with like vaccine records, or they may come in for a vaccine just to get, or if a child gets off of their schedule, many times our vaccine experts will help the family ensure that the child is quite complicated actually once they get off the vaccine schedule, getting them back on schedule. So the public health nurses know that vaccine schedule really well, and help the families and work with the pediatricians getting the child back on schedule.
sure.
So we work through that, and then referrals, before children go to Head Start, and lots of support programs
And
there.
it's one of those it seems like it's one of the situations that you're working not against the pediatrician, but you're working in conjunction with the pediatrician. And
Oh,
the nurses
absolutely.
are gonna recognize, or your high levels, highly skilled, professionals are gonna recognize, "Hey, listen, this baby's progressing very well," or "There's some metrics that the baby has not achieved. Maybe we should talk to your pediatrician about that," or, "Maybe we should look at, something else," or to that effect. Does are the pediatricians, are they like receptive to recommendations? Are they grateful? Because a lot of times, hey, I'm the doctor, you're not, and I just, this is what we do, and you spend a lot more time than the pediatrician does. Uh,
I believe the physicians really like the hands program, and we have families often that say their physician recommended that they do hands.
sure. And the hands program, it's not exclusive to Pike County, correct? It's
No,
all over the state of
that's
Kentucky.
correct. It's part of that core.
Right.
When I talk about public health transformation, there's three broad categories of public health services. There's foundational services, which are mandated by statute, and then in the middle tier of services are called core services, and those are services that every health department either most directly offer those services or ensure they are offered in their community, and that is WIC, hands, and harm reduction. So HANDS is one of those core programs that is not mandated through statute, but every local health department offers or contracts out to another agency in their community to ensure they are offered. And
In
HANDS is one of those important
in the
programs
state of Kentucky.
in Kentucky.
Is this a national program too, or is this just a Kentucky program?
Just Kentucky.
So how do you think the state of Kentucky fares with this program, and why would it not be? Are there anything that's comparable, like in Ohio or West Virginia, that's to this program?
There are other states that have programs that are similar, but in the state of Kentucky, we have hands in every county in the state. So if we have a family in Pike County and they're moving to Floyd County, we just call them and transfer
Right.
to Floyd County. But the actual name of the programs in the other states, I'm not familiar with, but I do tell them to go to their health department if they move out of state and find out what programs are comparable to
To
HANS.
hands, right? Exactly.
And they may have something more like First Steps, which is another program that we have in the area.
Sure. Exactly. And how long has the hands program been in Pike County?
That's a good question. I'm not
Mm.
exactly sure of the history.
It's 23 years, I believe.
Okay.
And when it first started out, has there been some progression of the services available since the time since its inception?
Well, in that regard, I mean, the curriculum is the curriculum. It has been updated somewhat over the years, but it's evidence-based, so it's remained fairly, similar to its original curriculum, would you not say,
Yes.
Paula? But I will say as far as like participation, so what we saw in participation, when I started at the health department pre-COVID, there were around 160 families in the program. And during COVID, we had to go virtual. So families and the visitors lost that direct personal
Sure.
relationship and families dropped off. And we've been building back. We had dropped fairly low post COVID, and we've built back to around, we're getting close to 100 families, maybe around 95. So that's something Paula's been working on. We brought on a new employee, and she focuses mainly on assessments. So that's where she goes out to, like maybe the physician's offices. She visits with families that express interest, works with different agencies, works with our WIC, our
Sure.
internal programs like WIC in the clinic, and touches base with families to get through the assessment process, which is really just like a quick questionnaire to ensure that they meet the minimum
Sure.
criteria for involvement. And it's not income based, although income can qualify you. Um, and so we're building that program. We're getting it back. I mean, we've really seen some great progress just in the last year.
Have you seen well, you mentioned COVID. During COVID, everybody was staying home. Everybody had to stay home. They had to stay, away from each other. Families can all. Did you see a spike in birth rates after COVID? And are you seeing a decrease in birth rates now? Because the national trend is that
Actually, we've been told that live births are down at this time. The number of live births are, we heard that from Dr. Stack at a HANDS meeting right after COVID. So we're hoping it's kind of steady, about the same, but I haven't noticed any surge.
An increase. I know I spoke with a physician at Pikeville Medical Center, one of the OBGYNs, and he told me that Pikeville Medical Center assists with approximately 1,000 live births per year.
Mhm.
Of course, that's more than Pike County. So, right here in our backyard, they're producing 1,000 babies a year, and we want more people to know about the HANDS program, the benefits of participating in the HANDS program and taking advantage of it. I mean, regardless if it's a Pike County baby, there's a HANDS program in every county in
Right.
Mhm.
Kentucky. So I know PMC services Floyd, Johnson, Martin,
Right. Yeah.
and even outside of our state, but we have HANDS programs for this entire region.
So the program is HANDS Health Access Nurturing Development Services, and I think nurturing development services is the key thing there
It
because what
is.
happens is that based upon what you told me, you're looking at eye movement, you're looking at hearing, you're looking at coordination, you're
Mhm.
looking at sleep and where they do their belly, can if they can
That's
get up and
exactly
raise their
right.
neck, the tummy times, if they do all those things, can they hear noises? Are they reacting to noises? Are their eyes reacting? And those are things that
Just hit it. You hit the nail on the head. Those are the
I
exact
got a
activities.
grandbaby.
Yeah.
Almost every night, my wife and I
I mean,
sit down and talk about how's Teddy doing? Is he doing? He hates his tummy time. He hates
I
tummy
need to see
time.
a picture of Teddy, actually.
He's the most beautiful
If he looks
baby.
like your son, he looks just like you.
He's a beautiful baby. So he's a
Aw.
good kid.
Tell him about maybe one fun game that the ongoing home visitor has planned that's part of the curriculum that they go out and the babies love it and it shows, some it measures some development.
Like, for instance, we take supplies, and we do a lot of homemade toys and homemade activities so the families don't have to go. They learn they don't have to go buy new toys to have these brain development activities with their child. So we do one that's called Pulling Colors. And so we save shoe boxes, we decorate up tissue boxes, and we decorate them like with duct tape colorful things. And then if it's like a coffee can, we put we have these strips of felt, different colors, and we'll tie them together and put the uh, all the fabric down in the can.
Right.
And then when we teach them, oh, you pulled out red, that's green, and so they're just pulling this long string of fabric. And that's a brain builder. It could be as easy as playing patty cake
Right.
or peekaboo, those kind of things. They don't have to have supplies but there's, or like stack and whack. I like to get the paper towels in the rolls and have tons of them stacked up and let them get some kind of toy to whack them and knock it down. And that's called stack and whack, and that's a brain development activity.
Sounds like something we need to do at my office here. We have a lot of frustration and anger we
Let's
got to
next
get
time I
out of.
come, let's play stack and whack.
That's
How about
exactly
that?
right. Well, that sounds like that really good thing. Sounds like that's a great program. So what we want to do is we want to encourage people to are having babies. They think they're going to have babies.
Right.
They're if grandparents or parents have their children are going to have babies, we want them to get in touch with the health department
Just give
because the
us a
health
call.
department's got some professionals, high level professionals
Yes.
that can assist in the nurturing of the development services of the child.
Yes.
So when we talk about nurturing a child, because we do know that, you know, healthy children are the future of our not only our community, but the future of our country.
Yes.
And if they're smart and they're healthy and they're alert and they're doing things, and you know, I would love to see the next president of the United States being brought up through this hands program by Paula Compton.
That's right.
That would be
Our
that would be a
babies
good thing.
are just as smart as any other babies in the United States.
That's exactly right. And I think the hands program is a wonderful program. So what we want to do is we want to encourage people to call 509-5500, go to the website, which is
Pike County Health.
PikeCountyHealth.com. Go to the health department. The information is on there. You can scan this
It
code if you
is.
want to. These brochures are you could pick them up at the health
You
department.
can. And there's lots of information on the hands program on our website.
On the website, yeah, there's a
Yes.
ton of information on the hands department. But what's most important is that we have high level professionals working in
Yes.
conjunction with the family who is stressed and has anxiety, the
Yes.
pediatricians who see this all the time that's don't worry about the
Yes.
kid, and the liaison is the health department professional
That's
that
right.
is the go between that says, listen, your baby's gonna cry, it's okay, walk
They may,
away.
they may be worried about like breastfeeding. We have
Or
a
yeah,
lactation specialist in house.
or when do I stop breastfeeding and can I give
Yes.
him mashed bananas at 3 months? Or do I
That's
give,
it.
how do I do this? Or what happens if he takes the food and throws it back at me? Is that
Right.
normal?
Right.
And, you can't
So,
call your doctor with that because they don't want to be bothered.
That you can't call them over every little
Right.
question, but you can
You
us.
can call you guys and say,
Yeah.
listen,
all
my
things
baby,
we address. And not only their brain development, it's so much. We talk about their cues and communication skills, even from infancy, their social and emotional development. Um, and the bonding
sure,
process of the mom and baby, and how we try to encourage mom, to do certain things to help build their bond with their baby, and which makes them a more secure baby or adult person later in life.
sure. And that's
That's
how
it's a comprehensive program.
yeah, and then you've got 2+ years of this, and perhaps 3 if there's issues that you guys do. So it sounds like it's a great learning experience. It sounds like it's a great nurturing program for the child and for the family. Ladies, thank you for joining me.
Thank you.
Paula, thank you for your time today. Continue to do the great work that you're doing. Teach the children well, and just like what's her name said, treat them well, and they are the future. And I don't even remember what she
I
said,
think
but
that's a song.
it is a song. I
They
believe
are.
that
I'm
children are
hearing
the
it. I
future.
can't sing, but
Whitney
I
Houston.
can hear it in my head.
I believe that children are the future.
Yes.
Teach them well and let them see the way. Or I don't know. I don't know. I'm
It's
not
a
a
good
lyricist.
song.
But anyway, so
Thank
Tammy,
you.
thank you again for joining us. Health Department, 509-5500, PikeCountyHealth.com. Go to the website. If you know of anybody who's going to have pregnant, if you know of people who are thinking about getting pregnant, send them to the health department
Give
because
us a
they'll
call.
give them a call and just say, listen, I'm thinking about getting my wife pregnant, or we want to get pregnant, or I don't know what to do. I'm stressed out. I got work. They will walk you through it and show you what happens, what to expect when you're expecting. Fair enough?
Fair enough.
Thank you, ladies. Have a great day. Go ahead and happy Hillbilly Days to you. Are you guys going to be at Hillbilly
Oh,
Days?
absolutely. We've got the mama booth, and you parents can take their children in safe, clean environment, change their diapers, breastfeed, and we'll have a lot of information at that booth near the bottom of the 99.
Beautiful. Thank you for joining us today. Have a great day. Again,
you.
Pike County Health Department. I'm your host, Jeff
you.
Vanderbeck.
Yep. Thank you, Jed.
Thank
All
you.
right.